And with that, I'll open questions. This was my view from yesterday afternoon.
That's a pretty nice view. That's awesome. Is that North New Mexico, I'm assuming?
Southern Colorado.
Oh, Southern Colorado.
Yeah, right by the Continental Divide.
Oh, that's beautiful with the colors changing. Yeah. It's a good place.
Yeah, it snowed there this morning.
Wow, that's great. How fun. Well, thank you so much for that, Brandon. Great, thought-provoking presentation. There is a question. Is psychedelic usage currently limited to research only in the USA? How does this differ in other countries? I'm actually going to cover that in a little bit, but Brandon, do you want to take a stab at that?
Sure. So I think it's a wonderful question, and thank you for bringing it up. So in the United States, it's only for research purposes, and the application process that must be undertaken is lengthy and very extensive, because getting that Schedule One permit. Um, Again, I'm not speaking for FDA or anybody here, and I'll go off. I think it's a bit. I think it's very excessive on the amount of it, not just with the psychedelics, but then the other area that I get questions on routinely is what about the safety and efficacy of marijuana, and and I really don't have the data there as well. Other countries, and each one's going to be a little bit different, but a lot of them do follow a US approach on what they schedule and what they don't. But the United States also, one of the reasons why we are such leaders in medicine in general is NIH and the amount of money that the government chooses to spend on healthcare here, and research, and um, one of our former residents and all is now an intensivist, is an was an ER physician in France, and he wanted to do research and resuscitation research. And while he was a successful attending, he still came over here, went through an entire residency process and fellowship just to be able to be competitive for NIH money.
Mhm. And yes. So there's a world map that I'm going to share with you guys in my presentation, looking at the countries that have it legalized versus like having ambiguous laws around specifically psilocybin. So stay tuned for that. Let me see if I had any other questions for you, Brandon. One of the things that concerns me, knowing the role of pharmaceuticals, um, just and where we are with the financial burden really of pharmaceuticals and insurance companies on patients, on patient population, and how much we're not really seeing any great effect from coming through this mental health crisis with what we already have. What concerns me, and this is just a concern, I don't know if there's no answer, is that when these ancient medicines like psilocybin that we bring in and we break it down into the synthetic form to be used, what is that what is that going to look like? Is it going to just be for profit, where we're going to see these pharmaceutical companies just want to make money out of it, right? Because we see this every single day that I practice medicine. I do this and I'm like, God, I don't, sometimes the studies that have come out, you just don't have any other option. But that's always a question in my mind, like where would they take it,
I'm not quite sure what the question was, but I completely agree with your statement.
It's just a statement,
Wholeheartedly.
I guess.
Okay.
Yeah.
Yeah, and I we there are just enough bad experiences out there that I worry that in the wrong hands, or is it even the right hands, with good intentions, we can exacerbate or worsen some of the trauma for some people.
Right.
And certainly, my goal is I want to minimize the harm, for those patients and not have them relive a horrible experience.
Yeah, absolutely. And I think, the role of intense psychotherapy before, during, and after, I think that's a huge thing. And I think, this is a point in time that we all have to make a decision what we need to put money into. As you said, this is going to be expensive. But, Dr. Lehman was actually looking at the ROI, and it is not even close. Like, it is so high in spending some money for these patients. It's like $7,000 for the whole treatment with MDMA, with the 8 hours, with two therapists. And, there's a minimal cost for the actual drug, like 4%. But to switch, it's just a shift, I believe, in how we are reimbursing things, um, where, and how much are we prioritizing mental health versus other disease processes. And I'm not saying one is more important than the other. It's that, looking at the investment that we're putting into people's mental health and what comes out of it is quite large, right? Where, you have an addicted mom who's no longer beating their child or is not dissociated anymore. And the intergenerational trauma that you can transmute versus continue on, Anyway,
Absolutely.
yeah, yeah,
Yeah, and stop the cycle and keep yeah.
yeah, yeah. So with that, I know we don't have a lot of time left. I will go through my presentation in about 20 minutes. Let me see. Oh yeah. Um, so there's a comment saying your comment reminds me of honey in derm, absolutely superior to Silvadene, yet pharma can market what bees make. So medical grade honey isn't a thing because natural honey already is medical grade. So Silvadene is still widely used despite honey's availability. Yeah, no, thank you so much for that.